Like you, I am heartbroken by the tragedies that have taken place across our country. The memories of George Floyd, Breonna Taylor, Ahmaud Arbery, and far too many others remain with us, and our hearts go out to everyone, everywhere who is grieving and searching for justice. The American Heart Association denounces senseless acts of racial violence against individuals and unnecessary violence in our communities. As a nonprofit healthcare organization, we are taking a stand on social justice issues because it's the right thing to do and because there is scientific evidence supporting the link between social justice and health equity.
Racial disparities in heart disease, stroke, and other chronic conditions exist and are well documented. African Americans are also more likely to be uninsured. There is also scientific evidence that African Americans' physical and mental health is negatively impacted by the inequities that exist. Add this to the fact that in the midst of a global pandemic and given barriers to health that exist, African Americans and other people of color are disproportionately impacted by COVID-19.
The American Heart Association has championed health equity for all people for nearly a century, and we are more determined than ever to eliminate racial and class disparities. We will redouble our commitment to overcoming barriers to health and to addressing social inequalities.
We must stand together as a relentless force for a world of longer, healthier lives. That is our mission, our contribution to a more equitable society.
People are counting on us like never before. We will listen. We will drive change. We will be relentless. Thank you for your support, and thank you for listening.
Good morning and welcome everyone to the second Empowered and Well Faith Town Hall. Before we get started, Pastor Sonja Dickerson from Dayspring Family Church will lead us in a prayer. Pastor Sonja.
God, we just thank you for another opportunity that we have to gather together. Oh my goodness, you have really shown us what gathering really means. It is when our hearts connect, even if we aren't in physical proximity. It is such a blessing to connect around a common purpose and a common, of course, the common love we have, the connected love that we have for you and for each other. So, Lord, we ask that you bless our proceedings on today. Bless those who are bringing us the valuable, life-changing information that we need in order to make it through this moment. Let our ears be open and our hearts open to receive and to implement what we learn. It's in the blessed name of Jesus we pray. Amen.
Thank you so much.
Excited to be.
Go ahead, Pastor Sonja.
I'm super excited to be here this morning, and I couldn't wait to tell you about the storm we had last night. Oh my goodness. When I came out this morning, there were trees down and it was, there were people picking up things and there was beauty after the storm. It was a beautiful day amidst all the branches and all the cleanup that was needed. The sun was shining through and it's a gorgeous day now, even though it was a really rough night. And I just wanted to encourage everyone. We're in a spot right now. We're going through some things, but after this storm, after this, if we just all work together and we pay attention and we continue to be diligent, we will make it through this storm and we'll see the beauty that's on the other side. You know, in order to have the fruit of the Spirit, you have to go through the opposite. So in other words, if you want patience, well, you're going to have to go through a situation that requires you to wait. And that's really what we're in right now. Situations happen where we need patience and it teaches us patience. So if we want this to end, we're going to have to wait and we're going to have patience and we have to be diligent. The race isn't to the swift, neither to the strong, but to the one that endures to the end. I want to make sure that we continue to endure, that we understand that the things that we were told to implement on the front end are just as important now. God is working out patience in us. He's working out love in us. He's working out joy in us. We're finding joy in things that we didn't have time to stop and pause to see the joy in prior to this. So I think it's just very, very important that we realize that A, there's going to be a beautiful day after this, but B, in the midst of it, we're developing. There are new things that are happening for us. Look at us right now. 5, 6 months ago, we wouldn't have taken joy in a Zoom meeting. It would have been monotonous. It would have been, oh, I have to be bothered with that. But now, I love seeing your beautiful faces in the boxes, and I look forward to it. And we are excited about new things. God has expanded us. Let's look at all the new ways we have to communicate and all the new friends that we have, the new community that we have. And so I'm just saying, don't be weary in well-doing. That's what the Bible says. Be not weary in well-doing, for in due season you'll reap if you faint not. So no fainting here. We continue to protect our communities. We continue to make sure we disseminate the information and then encourage implementation of the information that is given. We continue to listen, and most of all, we continue to love one another. So after that storm last night, that was really rough, we've got a beautiful day today, and that's what's going to happen after this pandemic. Thanks so much, Francesca.
Yes, it is a beautiful day on this first day of summer. And so we are so thank you so much for that wonderful word. Hello, everyone. I am Francesca Martinez, the National Health Equity Program Chair for Empowered to Serve in the Office of Health Equity. And I have the pleasure of hosting and being your moderator today. So I want to thank everyone for taking your time on this Saturday morning to be with us. And so we're going to begin today's program with some important dialogue and then share some exciting news for those who participated in our Empowered and Well Healthier Church Challenge. But I'm going to take a moment for all of our panelists to introduce themselves, because we've got some great leaders on the line with us today who are going to be sharing some amazing word and their expertise. And so I will start with Pastor Sonja Dickerson, of course, who just gave us our word. Pastor Sonja, if you'll just say hello and remind us what church you shepherd and lead.
Hello, we bring you greetings from Dayspring Family Church in Irving, Texas, and we are excited to be a part.
Awesome. Thank you so much, Pastor Sonja. Dr. Eduardo Sanchez.
Good morning, everybody. I'm Eduardo Sanchez. I preach to the Church of the American Heart Association. I'm the Chief Medical Officer for Prevention, and please, pastors, I mean no disrespect by saying what I just said. The smiles on your face tell me you didn't take it the wrong way.
Thank you so much for joining us today, Dr. Sanchez. We also have with us Dr. Jennifer Ellis.
Hi, I'm Dr. Jennifer Ellis. I'm a chief of cardiac surgery at Bellevue Hospital, which is also the largest public hospital system in the United States, the oldest hospital. Associate professor of cardiothoracic surgery at NYU, and I've been associated with the American Heart Association for a long time, I care to say.
Awesome. Thank you so much, Dr. Ellis, for joining us. Pastor Hosea Collins, you're joining us from the West Coast.
Yes, I am. Yes, I am. It's so good to be on with everyone from Calvary Baptist Church Hawthorne. This has been an exciting journey, and I just can't wait to see how things continue.
Thank you so much for joining us, Pastor Collins. My colleague, Pamela Garman-Johnson.
Well, good morning, everyone. I am Pamela Garman-Johnson. I have the honor of serving as the National Vice President of Health Equity, Impact, and Partnerships for the AHA.
Thank you so much, Pamela. And a former colleague and a wonderful movement maker, Terry Broussard Williams.
Hello, good morning from Austin, Texas. I tell everyone I'm the best trained volunteer the AHA has. I've crossed the bridge after being an employee for 16 years to now serving as a volunteer for the association. It's an honor to join you all.
Wonderful. Thank you, Terry. And we also have a special guest from our partner, WW, Monica.
Good morning, everyone. My name is Monica, and I am here in New York City. Honored to be here. I am the head of inclusion and diversity at WW.
Wonderful, thank you. And we have our two wonderful chat hosts, Ms. Arga Kaysen and Katie Bond, who will be serving and as our chat hosts again, and will be dropping any links, answering any questions. So if you have any questions, please feel free to reach out to Arga and Katie. And thank you so much for monitoring our chat box. So again, we're so grateful for your time and commitment today as we continue this very important community conversation. You know, we began our first town hall in April, and that recording is actually available on our website at empoweredtoserve.org if you want to watch that or listen to it again. So we've got some great topics in store for you this morning, and we encourage you to ask questions. So as you listen to our panelists, you can either type your question in the chat box, or you can email us directly at empoweredtoserve@heart.org. And once again, that's empoweredtoserve@heart.org. And this webinar is being recorded, so check our site later this week for the replay. And we know now more than ever that people are turning to their faith communities for help and hope during the COVID-19 pandemic and the continuing racial injustices that we're experiencing, that we're painfully reminded of every single day. Our mission is to be a relentless force for a world of longer and healthier lives, and that is more important than ever. Our top priority is the health and well-being of individuals and their families in every community everywhere. And so to begin this critical conversation, let's start with Dr. Sanchez and Dr. Ellis. So Dr. Sanchez, you've been joining us for these past couple of weeks, giving us our COVID-19 update, but tell us what we need to know about COVID-19 as of today.
You know, I'm so happy to be here, and I'm so grateful to all of y'all who are on, and I'm grateful to all of y'all who have been participating all these weeks. You know, man, a lot has happened over the course of just the start to now. I will tell you that the video that I hope y'all go and watch that comes from Nancy Brown and Bert Scott were meant to sort of put things in context, which was their expression on behalf of the American Heart Association, acknowledging that these are really tough times, never mind COVID-19, really speaking to the disharmony that's taking place in the United States and our commitment to be a relentless force to address health equity and to be a force against racism in the United States. So you'll see it. It's way longer than that. That's the Cliff Notes version. But I would be remiss if I didn't say today is June 20th, the day after June 19th. I grew up in Texas. I've known what Juneteenth is for a very, very long time. So today I want to do a few things. We're going to do some history, civics, epidemiology, cardiovascular health, and then some basic public health. And if it was up to me, you could get continuing medical education for it, but let's see. And I'm going to try to be really pretty quick. But first, the history lesson. 89 years after the words, quote, "We hold these truths to be self-evident, that all men are created equal, that they are endowed by the Creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness." That's July 4th, 1776. It wasn't until June 19th, 1865, 87 years later, I think I calculate 89 years later, that news of the Emancipation Proclamation, which took effect January 1, 1863, was officially delivered in Texas, a slave state, and proclaimed that all slaves in Texas were free. Now, all joking aside, there was no email, there was no telephone, so it took 2 years to get that news to Texas. But you know what? Frederick Douglass said, "Slavery is not abolished until the black man has the ballot." The vote didn't come to black men, and let's be clear, that language of our preamble needs to be more inclusive, and maybe we need an amendment to change that, but I'll come to that in a minute. In 1870, the 14th Amendment, which provided citizenship to people who had been freed from slavery, and the 15th Amendment, which provided black men the right to vote, were passed in 1870. And we know the legacy of the vote for African Americans and other disenfranchised people. Voter suppression has been a thing since 1870, I would say. The 19th Amendment in 1920 gave women the right to vote. So the preamble needs to be about all human beings being created equal, and the unalienable, that's the toughest word to say, of life, liberty, and the pursuit of happiness. So life and the pursuit of happiness is something in terms of equality and our rights to pursue it that has eluded us. And the word for me for the day is disproportionality. So let's come back to COVID-19 and talk a little bit about disproportionality. In the globe, we are about to hit 9 million cases of COVID-19, something that was brushed off by many political leaders in the world as something that would just pass pretty soon. It ain't passing anytime soon, ladies and gentlemen, and we are going to hit 500,000 people dead from COVID-19, I would say by mid-July or so. The United States has 25% of all the cases of COVID-19 in the world, with only 4% of the population. There are lots of things that we should be proud of being number one. That is not one of them, ladies and gentlemen. That's a sad statement about our inability to have addressed something that we knew was coming, we've been dealing with for a while, and we have not done a very good job. In the United States, there's variability, some disproportionality, if you will. The Northeast experienced, and Dr. Ellis, you were in the vortex of COVID-19 for probably a long 2 months. That is waning, and what we're beginning to see is activity going on in other parts of our country. California, Texas, Oklahoma, Florida, and it's not occurring at exactly the same time or in the same way. In 20 states, COVID-19 is on the rise, and that's worrying. The AHA is committed to a world of longer, healthier lives for all. We're committed to health equity and the elimination of health disparities and disproportionality. Early on with COVID, we learned from China that the elderly, particularly persons in their 70s and 80s, and persons with underlying medical conditions, cardiovascular disease, high blood pressure, and type 2 diabetes, as described by those who were describing what was going on in China, were disproportionately affected by COVID-19 by having way higher mortality. If you had those things and you got COVID-19, the likelihood of death was way higher. As I said, communities and states are experiencing COVID-19 disproportionately. But what we've witnessed in the United States is that on top of that disproportionality that is based on or affected by age and disease in this country, a couple of things. One of the disease categories that's an add-on is people who have obesity, particularly who have morbid obesity at higher risk of bad outcomes of COVID-19. But we've also witnessed disproportionality by race and ethnicity. Among African Americans, increased hospitalizations and increased mortality compared to everyone else. Among American Indian Alaska Natives, increased hospitalization, increased mortality compared to others, lower than African Americans, however. And among Latinx, what we're seeing, and we're beginning to see this more and more in Texas, higher rate of hospitalization, but deaths don't seem to be proportional to the population. It's not clear whether that is what sometimes is called the Hispanic paradox, that you can make us sick, but you can't kill us. And I'm saying that somewhat jokingly, but it may also be that the Hispanic, the Latino population in the United States generally skews younger. And remember, age is a factor. So when you add age and disease, that's just a bad combination. And it could be that just disease isn't as bad. And so this is what we're seeing. So there's disproportionality in addition. So that's what happens with COVID. But the American Heart Association, which has been tracking cardiovascular health and the things that are resulting in some disproportionality, include what we know, which is that among African Americans, hypertension is higher than all the other major race ethnicity groups off the charts, and mortality due to cardiovascular disease and mortality and stroke is higher than other groups off the charts. You look at graphs and you just say, how can this be? And it may be that is another one of the, there may be some underlying factors that have contributed to that before that are resulting in this outsized mortality among African Americans. And then for all three of the major groups I talked about, African Americans, Latinx, and American Indian Alaska Native, higher prevalence of type 2 diabetes, higher prevalence of obesity compared to the other groups, the other groups that one generally talks about. When you add on top of that, the notion that there may be groups who are getting infected at higher rates, what is probably driving that is increased exposure to others. What do I mean? People who are low income are working let me put this a different way. People who are doing essential work in the United States of America, healthcare workers who are not the doctors and nurses, but are healthcare workers, people who are working in transportation, food production, food delivery, agriculture, are people who are working, have to go to work because it's essential, but are paid among the lowest incomes in the United States. There are also folks who have been, if you were in the restaurant business in any way, shape, or form, you are among the people most economically adversely affected by COVID-19. You do not have a job. So there's a combination of things. If you're an essential worker, you're going to work. And just being around more people, ladies and gentlemen, increases the likelihood that you might get infected with COVID-19. The only way to get COVID-19 is to come in contact with someone with COVID-19 and they breathe on you, cough on you, touch you, whatever it may be. You cannot get it if you're in complete isolation. You cannot. You get it by being in contact with others. The more you're in contact with others, the higher the likelihood that you're going to come away with COVID-19. If you get to do like me, which is be in my house and never leave, have people bring me stuff and drop it at my front door, I do everything by Zoom, I have very little chance of getting COVID-19. But if I have to go to work in a supermarket or drive a bus or work in a meat packing facility, if I work in a nursing home, I am exposing myself because you're coming in contact with other people. So let's be clear. No COVID is the goal for all of us right now. And there's only a handful of things that are going to protect us. They're pretty primitive, quite frankly. There's no fancy medicines right now. There's no vaccines right now, but there's some primitive measures. They were the measures that were used in 1918 during the big pandemic that killed millions of people. And I like to call them the 3 W's plus 1. Wear a mask. Wearing a mask doesn't protect you from COVID-19. It protects others because you may have it, don't know it, and are spreading it. There is asymptomatic COVID-19. 2, watch your distance. Need to be 2 feet away from other people. And if they're talking the way I'm talking right now, you need to be 10 feet away from other people because I'm spitting and talking and spreading my stuff. And 3rd, wash your hands a lot. And washing your hands, you just need to do because even though the way the virus spreads is mostly through this stuff, if I'm doing this and I spit on something and you come along and touch it, and then you touch your face, you can get COVID. It's not the most efficient, effective way, but it is a way. Wash your hands, wash them a lot. And the plus, take your medications if you have an underlying medical condition. You need to protect yourself. And when you're taking your medicines, remind yourself, if you're having to take medications or you're 70 or 80 and maybe even above 65, stay the heck away from as many people as you possibly can. because if they're not trying to protect you, you need to protect yourself. You know what? I'm tired out. That was a lot, but I think I covered all the things I wanted to cover. I'm going to get one step ahead. If what I said made you feel like your chest is crushing or you can't move your body, and I'm not trying to be flip, if for any reason at any time you're thinking the American Heart Association says these are the symptoms associated with heart attack, these are the symptoms associated with stroke, these are the symptoms associated with heart failure or COVID, call 911. The safest place that you can go right now in the United States of America is a hospital emergency room, not the supermarket, a hospital emergency room. I got asked one question I'm gonna answer. Do you need to wear a mask if you're alone in a car? No, you do not need to wear a mask if you're alone in a car. There's no one to breathe on. When you leave your car, wash your hands because you might have been coughing or something and gotten some stuff on your hands. Don't wear a mask in a car, probably affects your vision anyway, your peripheral vision. Wash your hands when you get out, whether you carry it in the car or take it with you. I'm gonna stop there, Francesca. I've just occupied a boatload of time, but maybe I don't ever have to talk again today.
No, thank you so much, Dr. Sanchez, for updating us and then for calling out those important things that we need to know. And so I'm going to ask Dr. Ellis to kind of piggyback off what you said a little bit regarding disproportionality and the trust of medical community, right? And right now, many of our communities, we know through not only COVID, but also the racial injustices that have been plaguing our communities for hundreds of years, that causes a trauma. So talk to us about how, mental health during this time, and then our overall wellness is impacted by what we are experiencing right now.
Okay, I agree completely with everything that Dr. Sanchez says. And I do have to briefly acknowledge with a very quick story about Juneteenth. I went to high school in Connecticut, and part of our civics U.S. history, I had to learn about Eli Whitney and the cotton gin. I had to learn the state motto of Connecticut, which is, I still remember it, that which is transplanted sustains. And that's why you have the Charter Oak and all that. I even know the 8 counties of Connecticut. We heard nothing about Juneteenth. I didn't know until I was an adult that Reconstruction was only 12 years. Jim Crow was never mentioned. So when you're talking about with the healthcare disparities and this lack of trust, the lack of trust goes back to Georgetown when they sold their slaves to the South. And they were told when they got permission from the Pope, they said, we promise they asked for 3 things. And the Pope said 3 things. 1, that they won't be going to someplace bad, that the family units will be maintained intact, and they'll be allowed to continue their religion because they're all Catholic. None of those things happened. They were sent to the Deep South. The families were broken up and they weren't allowed to have their religion. And it was bad enough that because of this, the Catholic Church no longer owned slaves. It took them a while to do some other things, but because of that, so when we talk about reparations, this is actual generations that you can still follow. That's why there are these pockets in Louisiana of Catholics that came from Georgetown. And then you go to Tuskegee, where for 40 years, people weren't being treated because we wanted to see the last. Or if you go, as I brought up before, you go to the 2000s, this happened this century, where in Baltimore, a study that was supported by Johns Hopkins did not take lead out of houses. They were trying to see if there were cheaper ways of doing it to get more housing out. And yes, the guys had good reasons for it, because instead of having those abandoned buildings that had lead contamination and it was costing too much, they would say, well, maybe we can do something a little bit cheaper. They told those parents for the underserved population that those buildings were safe. Children went in there without lead and they came out with lead poisoning. And when the judge found out about it, and it's a great, I'm a geek, it's a great decision to read. She used words like Tuskegee and Nuremberg. And at one point she said to the researchers, would you put your kids in that? And they said, of course not. That is the definition of healthcare disparity. So how do we get our trust with the patients? Some of this is some of the basic common courtesies. You know, some of this is the stuff that we learned as children, where I would never talk to somebody of my grandmother's generation and call them by their first name, because my grandmother would not tolerate that. And I liked living, and I liked, you know, eating her good cooking. And I didn't want to be punished. But you have some of these young residents who are in a different, raised differently, and they're not bad people. They're not evil. They have, their heart is in the right place. But because they haven't been exposed to this population, they offend without even knowing. So that's one of the reasons why it's so important to have at every level, residents, physicians, medical students of color, because, you know, my resident actually did this a couple of weeks ago. He went in and called, and he's a fellow. He's been in healthcare. He's 9 years after med school, and we're training him. And he went in and he called an older Black woman by her first name. And I didn't make a fuss at the time in front of her, but I took him aside and I said, don't do that. If she says to you, please call me Mary, that's a whole different thing. But until she does, remember that you are a white male who has had all these advantages, and you are coming into this room, and she's in a very, very, very risky position. She's sick. She has heart disease. She's needing heart surgery. And you're coming in and you're all of a sudden taking away some of her agency. You are not, I understand that you're not being a bad guy, and I understand that your parents always, you know, you called your parents' friends by their first names. That's fine. This is already a system and a situation where the power is not equal. And you, by definition, have to help give her that power. Now, that was a teaching moment that took actually quicker than I just related it. And, so that's how we get rid of some of these disparities. Because how can you come in if you don't know where the person has come from, if you're not appreciating what their issues are? You know, if you're saying to the patient, oh, he's non-compliant because he didn't come in for his follow-up, but you didn't say, why didn't you come in? Oh, my ride fell through and I couldn't get here. Or you have that patient, they're non-compliant with their medications, but only when their granddaughter is away. And then you find out that they're functionally illiterate and they actually can't take their pills. And so the reason why they take their medicine when their granddaughter is around is because she gets one of those trays and fills them out. And so when she goes away for a vacation or something, they don't know how to take their medication. So these are the kind of things that you have to really drill down and find out what's the story behind the story before you just say, oh, these, you know, they're not compliant, they don't know what they're doing. You know, I told them to eat a lot of vegetables. There is no grocery store. I told them to walk. The neighborhood is dangerous. I mean, you know, so these are the issues that we have to get if we really want to address disparity.
Thank you, Dr. Ellis. So with our faith leaders and members of our health ministry on this call, what can they do? And I'll give this question both to you and Dr. Sanchez to help with that trust. Is it being, you know, more of a patient advocate? If they see someone in their congregation that maybe doesn't have that family, right, to go with them to the doctor, how can our faith communities help build that trust, and or what tools can we give them to help lead in this front?
I'm going to just add a couple, because Empowered was actually great about this. Because if you educate the pastor and the pastor says, we're going for a walk, guess what you're doing? You're going for a walk. If the pastor believes that this is important and has the farmer's market come in, and if we, as a part of the Heart Association and Empowered, can educate the pastor, then that is somebody that when they spread that to the congregation, they can believe it is not somebody from outside.
I completely agree with that, the degree to which behavior is modeled is very helpful. I'll go a step further, and honestly, I'm so much answering chat that I might have missed part of your question, Francesca, but I'm among friends. There is, we know that navigating the medical clinical care delivery system is really, really challenging. And even people like Dr. Ellis and myself get tripped up with all the degrees we have and being doctors. It is not an easy thing to do. And one role that I think faith communities can play through their parish ministries is knowing community health worker kind of work, and the patient navigation part of that, and offering, when possible, that support so that people can navigate these really, really challenging situations. Right now, it may just be trying to figure out how to do a telemedicine visit. Someone in the parish may know how to help an elderly person or somebody who's just not quite computer savvy. But sometimes you need that advocate who can hear and then say, no, that may not be the best option for this patient at this time. Maybe this one would be a little bit easier. That can be a very, very helpful thing in these times, including advocating in time of COVID, advocating to get a test, where in some communities it's easier than in others. So agree, pastors can play a tremendous role just by engaging the congregation, but also through parish ministries, that support can be extended into the actual engagement of the clinical care delivery system.
Thank you, Dr. Sanchez and Dr. Ellis. And Dr. Sanchez, you said something regarding advocacy. And so I'm going to turn it on over to Terry Broussard-Williams and Pamela Johnson to talk to us a little bit about that. First of all, Pamela, if you will just quickly remind us, AHA has had a varied story history with our faith communities, and talk to us a little bit about how working with our faith communities has helped reach some impact and help with better health outcomes. And then Terry, I want you to touch on, what faith communities can do to get more actively and civically involved.
Thank you, Francesca, for that opportunity. Again, good morning. This morning I had Bible study, and one of the scriptures that we focused on was James, the 2nd chapter, the 14th through the 16th verse. And I thought I would read that so that I can ground us into what the Heart Association has done. What good is it, my brothers and sisters, if someone claims to have faith but does not have works? If a brother or sister is without clothes and lacks daily food, and someone says to them, go in peace and stay warm and be well fed, but you do not give them what the body needs, what good is it? This scripture is such a reflection of the journey that the Heart Association has been on for 20 plus years. And I've been in Heart for 20 plus years. And I did not start in the work of focusing on the faith community, but I would say about halfway through my career, I was intrigued by the work that the Heart Association was doing. And but what I have learned, especially over the last 7 years, was to listen to what the faith community was saying to us, and to also say, we may have been doing work alongside the faith community, but we really were asking the faith community to execute based upon what we thought were solutions. And what we have definitely learned, and being very transparent, was through the listening, we knew that we had to be able to pivot and create, alongside the faith community, faith-centered solutions coming from the faith community. Even through Empowered and Well, you have taught us so much, because we have refined our approaches. You told us what was working well, what wasn't working well. And even through the things that you may have proposed, even if that didn't work quite how we thought it would, there was grace and mercy to be able to pivot and create additional ways for us to communicate and then be effective. This pandemic forced us to move from being in person, being in a very touchy-feely environment that we are used to, and now we are on these Zoom calls and we are still connected. And even though you may not have seen everything that we did to pivot, but please know there were a lot of late nights and hours listening to what you were saying to create an infrastructure that met your needs. And so for that, we thank you. We thank you for giving us the feedback that we need to be the best partner alongside you in ensuring that we can deliver and execute in a way that is most beneficial. The other thing that I think is important to talk about is, in order for the Heart Association to work alongside the faith community for transformative change, we have to recognize that we have to create an infrastructure for sustainability. It is not effective to just, have programming here, there, and, many organizations tap the faith community, but it is so important to have that consistency and the infrastructure. And what does that look like? That looks like being able to invest for the long term, so that we are addressing the social determinants of health that Dr. Ellis, Dr. Sanchez both referenced, about access to healthy food, access to quality health care, access to affordable housing. All of those determinants really drive the health outcomes that we have presently. So what do we do now to invest so that we can really truly address those issues so that we can have better health outcomes? And that will allow us to see a reduction in blood pressure, reduction in diabetes, a reduction in obesity, and ultimately cardiovascular disease. And so we, the AHA, definitely want to strengthen our relationships, and we know that we have to continue to uplift this pillar. And I thought I would leave you with an example, and you'll see a link included. It's the Imani Village. The Imani Village is a part of Trinity United Church of Christ in Chicago, and they're not the only one that has this type of village, but it's what I would call a wellness village. It really includes both healthcare, access to food, wellness, housing. It's a walkable community. It's not about taking people out of their community to go somewhere else. It's all in their village. And so that's what helps to build the trust. That is what helps to us to be able to create that network, because you're in a village that you're supported. So we really do thank you for this opportunity, and because each one of us is empowered to serve.
Awesome. Thank you so much, Pamela. And our hope is that we have some Imani villages across the country. Now, Terry, tell us, what can faith communities do? What are those action steps? We know that there are things in our communities we want to change. We want to have street lights and walkable streets and access to healthy food. But give us some actual practical things we can do if we want to step into more of that advocacy, advocating for more equitable policies.
Absolutely. And I want to zoom out a little bit and just honor some of the things that have been said on this webinar today. And I think Dr. Ellis set things up so beautifully. I am from Lafayette, Louisiana, and now live in Austin, Texas. And that means I'm the daughter of the perceived desegregated South. I say perceived because inequity still exists today. Lafayette has the largest Catholic diocese in the country. And so when I was growing up, there were more Black Catholic churches than Blockbuster, literally. And here I am in Austin, Texas, and there's only one. I don't even have a choice. My choice is to go to a Black Catholic church or to not. So there's so many things that are rich in the South. And so many things that have caused systemic issues. And when I really think about what I learned in my time in Louisiana, so much of it are the tenets of what you all have talked about today. You know, lift every voice and sing. We make sure that we all feel the synergy and love within our community so we can take care of each other. And that means definitely wearing our masks and washing our faces, like Dr. Sanchez said, but also lifting every voice so we can go out and vote. And that's part of it, right? But the next step is really to lift every voice by acting. Really going into communities, educating people on policy issues, holding lawmakers accountable for the change that they say they want to see, but many times they actually don't enact or implement, and then us demanding it when it does not come. And so I think the American Heart Association is so uniquely positioned to allow people like you to do that. We can provide the tools and the inspiration for you to really get in the street, in the homes, and in the community of people that look like us to enact change. And there's something for everyone. Literally, there's a policy that you can all get around. Now, I left the association in November and been volunteering ever since. So Francesca hooked me up with a list of things that are happening now. And when I looked at that list, I should say, much not to my surprise, the list has been the same. It's been the same for almost a decade, if not longer. And that's because change does not come easy. And we have to apply that pressure and really hold people accountable. So some things that you can do to take action are really paying attention to the way that the dollars are flowing from the federal government to state governments and to cities. At the federal level, you really want to keep an eye on CDC funding. We want to ensure that the CDC has the dollars it needs to protect all of us. And so the American Heart Association does advocate for that. When it gets to the state level, there's a lot that they're working on as well in regards to children and their meals. We want to make sure that children have access to nutritious meals in their communities, especially now because of COVID-19. Kids aren't in that routine of going to school every day. You know, my very first job in Lafayette was handing a child a milk at lunch and clicking a clicker to count how many kids would go through the school lunch line during the summer. Summer meals are so important. So really pay attention to child nutrition in school and the nutritious meals that come along. Now that so many people are going to the hospital because of COVID, there's an intersection of something the Heart Association's been working on for a long time and something that will hit our communities really hard. You know, for example, in Louisiana, the African American community makes up 35% of the state. But when I last checked, 70% of Blacks were the COVID patients, including my family. My mother, my brother, my great aunt, who's 85 years old, was in the hospital for a week. 8 members of our church died of COVID. I could go on and on and on. Now that they're returning home, they're going to be getting medical bills and they're going to be looking at those. And surprise billing will hit us during these COVID times as much as they hit CVD families every day. And so we really want people to understand what is surprise billing. And that is something that the American Heart Association is also advocating for. We've all heard the stories of $100 aspirin, right? And so we really want to make sure that those bills are very transparent and easy to read. And that is something that you can advocate for now. Another policy issue is safe routes to schools. We want to make sure that everyone has the opportunity to have a safe route to school, as well as biking and hiking trails in their communities. You know, we know that, especially right now, the best way to get exercise is by walking in your neighborhood. You know, when I did not have access to my gym while I was waiting for that exercise bike to be delivered, I was hitting my street of my community. And so we really want to ensure that those things exist. And so I want to encourage you to learn about those issues at you'rethecure.org. Things are always very easy to read and to navigate, but you have to take it a step further. You know, you want to educate those in your community about those issues and challenge them then to take action, to not only just click and send an email to their lawmakers, but to pick up the phone and call their city council members, their state lawmakers, and their federal delegations, because that's how differences are made. And so I started off by saying that, you know, I'm the founder of a platform called movementmakertribe.com, and it's where I encourage people to start movements big or small. And one of the tenets of Movement Maker is saying that leaders turn moments into movements. That's the sign you see behind me. I'm reminded of that in everything that I do. And so each of you are leaders, and you're leaders at this time when our country and our world needs you most. And so I want to encourage you to start a movement, big or small, because it's going to take every single leader to turn this moment into a movement.
Thank you so much, Terry. And I heard this a week, one of our empowered scholars said, leadership is not a position, it's an activity. So, we can all be leaders no matter where we are within the church, right, within our health ministry, in our community. So thank you so much for giving us those practical handles as where we can start. And many of you were part of our health lessons. And so we had that call to action to join You're the Cure. So if you didn't, we'll give you that opportunity again. We're going to drop that number in so you can text to join You're the Cure. But there's also some great websites, and again, surprise billing, ensuring that dollars are getting to our communities. And so I know, Dr. Sanchez, you said vote, but another component is the census, right? Because we all need to be counted. So making sure you've completed your census, and if you're in a faith community, making sure those within your faith community have completed the census and are registered to vote. So I know that we are running a little bit out of time, but we still want it. We have so much more to cover. So stay with us. I'm going to turn it over to Pastor Sonja and Pastor Collins. They both led their churches in the Healthier Church Challenge. And so I want them to talk to us about where their church ministry was before and how it is now, or where you are now in that healthier journey. So I'm going to let Pastor Sonja go really quickly, and then Pastor Collins, you can go ahead and follow suit. And let us know, how did the Healthier Church Challenge amplify your health ministry? Oh, Pastor Sonja, I think you're on mute. There you go.
Okay. The Healthier Church Challenge was just really a great blessing here. The information that we received from AHA was just really life-changing. And then the community that we received with WW just provided the support that we needed and encouragement that we needed. And now we're really empowered, literally, to keep it going. I think the biggest aha for us is that we don't have to just live with the things that have been staples in our community, blood pressure, diabetes, that there are things that we can do to change the narrative, and especially to help the generations coming behind us. So we are on fire, and we just wanted to keep going, and we just love it. So thank you so much, Pastor.
Wonderful, wonderful, wonderful. Definitely, I concur. If you ask me where we were versus where we are now, simply put, we were ignorant and unhealthy. Now we're informed and on the right track. But no, honestly speaking, what this really did for our church, it created a community of engagement, which made it so much a support group to really encourage one another. And it made it fun. Like, so much creative fun came out of it. So many workout classes. At one point before the pandemic, we had classes 5 days a week where someone was leading, whether it was Zumba, whether it was weightlifting, whether it was dance classes, line dances, just so many things. And people were really excited and engaged. And we had to get really creative after the pandemic. And we started offering these classes online with encouraging people to join. But it really created the community and the empowerment through knowledge and allowing us to hear it more often. Faith cometh by hearing. The more we would hear in these weekly classes about our health and about what needs to be done and about how important it is and about this being one of our spiritual duties. Because if we don't take care of the temple, which is this body, where will we live? You can't carry out God's assignment if you're not healthy. So it's been a huge plus, and I'm grateful that it wasn't something that, like, even after today, this is something we're committed to continuing because it's a part of our ministry now.
Wonderful. What would you tell other faith leaders out there who, want to supercharge their health ministries? What are those steps that you're telling, to tell them to kind of keep things going?
Real simple, simply put, make it a priority. Like, I think we're not, I will confess, I wasn't doing my full job as a pastor, only focusing on the spiritual and mental component. Because if we don't take this physical component into play in our congregations and in our pulpits, then we're not dealing with the whole man, spirit, soul, and body. So I think it just has to be one of the priorities as it relates to what God has called us to do. If you're not taking care of the whole man, we're not doing our job. So thank you for helping me do my job.
Yes. Yes, I agree with that. And also setting the example. So it really made me evaluate what kind of example am I setting. The church is the hub in our community. And so it's not an option for us to talk about health. It's mandatory that we talk about health. And now we really see the significance of that. And we are in a caretaker position where we must protect and show love thy neighbor as thyself, and love them by helping them by saying, let's take a walk, let's eat right. We're distributing fresh vegetables all week and every week, and just helping people eat better and be well.
Wonderful. And so, we're going to go ahead and drop your church links in the chat box. So if there's anyone that would love to connect, we are a family now in the Healthier Church Challenge, right? Across the country, we've all been part of the Healthier Church Challenge. And so we are so excited that we had a wonderful partner with us, with AHA, in the Healthier Church Challenge. WW, I'm going to go ahead and introduce Monica Pierce, because I know many of you are members or members of churches that participated in the Healthier Church Challenge. So we've all been eagerly anticipating some exciting news as we've wound down the program. So Monica, I'm going to turn it over to you and let us know where we are, if we got our 2 winning churches and who they are.
Absolutely. So I just want to say that I am so honored and so proud to be here with you all today, discussing and addressing such critical issues like systemic racism and health disparities. Also very excited to share the news about WW and the Healthier Church Challenge and the partnership with AHA. 2 years ago, WW launched an Impact Manifesto, and it's a statement that we live by as an organization. And that statement is, we inspire healthy habits for people, families, communities, the world, for everyone. And we truly mean it, and we are looking every day to find ways to live it, to make sure that we, like Terry said, lift our voice with action. So when you think about what our mission is in our manifesto, it's just such a natural connection for WW to sponsor a program like this. Both WW and the American Heart Association believe in a world where everyone, everywhere has an equitable opportunity to live a healthier life, longer lives. And this program was just one way to help us to move forward in that vision as partners. So we've, WW has enjoyed working with the American Heart Association in launching the first Empowered and Well Healthier Church Challenge. We are so proud of every single church for their amazing spirit of determination to stay the course no matter what, even during this global pandemic. For those of you who are joining us today who might not be so familiar with the program, I'm just going to share very kind of quickly some highlights and the general idea of what this Empowered and Well Healthier Church Challenge was. So it kind of stemmed in the fact that we know cardiovascular disease claims the lives of more Black women than all forms of cancer, accidents, assaults, and Alzheimer's disease combined. We also know that the church is the bedrock of the community, a place of faith, support, inspiration, and influence. So this is why we established this Empowered and Well Healthier Church Challenge. We have the power within ourselves and within our communities to make a change and to change how we address and how we focus on our health and wellness. And so this challenge that we have is really helped to bring that to life. So what we did was we kicked off in 6 markets earlier this year, and those markets are Atlanta, Charlotte, Dallas, Los Angeles, New York, and Washington, D.C. And in that challenge, it included 12-week health lessons about topics such as preventative health strategies, healthy weight loss, blood pressure management, diabetes prevention, nutrition, wellness, all of the things that are so important to living a healthier and longer life. Some of these churches were also able to set up on-site WW workshops led by trained WW coaches who were dedicated to inspiring healthy lives and sharing tools and science-based techniques that we know work. We even had some amazing WW-sponsored surprises along the way. Some unsuspecting members won tickets to the Oprah's 2020 Vision Tour earlier this year, and a few churches even received unexpected visits from Miss Winfrey herself. So we started off this year with a huge bang, and everybody was just, so excited. And then we had that kind of shift, right? Because of COVID, we had to pivot very quickly. And as Pamela mentioned, there was a lot of late nights, a lot of how do we make this work? How do we still support our communities? Because it's so important, and even more so based on all of the numbers that we know that are associated with our communities and with COVID. So we pivoted from this in-person meetings to online and virtual worlds around mid-April, and all of you just charged ahead. And again, so proud and so honored to be a part of this amazing experience. The American Heart Association and WW are definitely committed to helping you stay healthy and well, even past this challenge, while we're still kind of sheltering into place and just finding our ways back into the world. We heard from many of you that shifting into an online virtual world was a blessing, and that the online health lessons and WW workshops that went virtual as well helped you to keep your teams informed, connected to one another, lifting each other up, as the churches temporarily had to close their doors. And so this was a great outlet, a great opportunity to stay connected and stay focused and hold each other accountable. So across these 6 cities, we had 38 churches that participated in this challenge. So I just want to take one moment to congratulate our top 5 churches as we kind of did the scoring and how they ranked on the score. So we have Calvary Baptist Church of Hawthorne in Los Angeles. We have Community of Hope AME Church in Washington, D.C. Second Baptist Church in Los Angeles. Turner Chapel AME Church in Atlanta. And then we have Victory Seventh-day Adventist Church in New York City. So just a moment of congratulations to those churches that were in the top 5 spots when we did our kind of ranking for the challenge. So now I'm sure you guys have been waiting patiently, maybe a little anxiously, to hear who are the actual winning churches. So the 2 churches I'm about to announce were selected because of their outstanding work that they've done with this challenge. Both churches completed 12 of their health lessons. They recruited outstanding numbers of participants, and then went and set up additional webinars, activities, challenges to support their members, and just kept inspiring and changing lives in very creative ways. Again, given the fact that we're all separated and only connected through virtual learnings. So these 2 churches that I'm about to name, they will receive $5,000 to continue their wellness ministries and to continue to keep inspiring and challenging us to do better and focus on our health and wellness. So without further ado, those 2 churches are Second Baptist Church in Los Angeles. So a huge congratulations to Second Baptist and to Ms. Helen Starks for her work in ambassadorship. And then we also have Calvary Baptist Church is the second church of Hawthorne, located in Los Angeles. Again, Calvary Baptist did just amazing work, supercharged their health ministry with weekly events like Pastor Collins has mentioned, the Zoom dance parties, the physical activity challenges, water challenges, just again, ways to keep motivating, inspiring their community during these tough times. So Pastor Collins, I know that you are excited, and I will share with the larger group that before we had even finalized the scoring, Pastor Collins was invited. So this is news to him as well, that he's part of one of the 2 winning churches. So just a big shout out and congratulations to not only these 2 churches, but all of the churches that participated in this challenge. It's such an amazing task, and I'm so proud again to be a part of it, to help to usher it forward. And I hope that as we continue, we will look for other ways to partner, to move forward together, because this change is so important, and our health is so important, and we do need that support. These churches later this month will have an opportunity to virtually celebrate their winning, and they will celebrate that with award-winning gospel singers Brian Courtney Wilson and the WW ambassador Tamala Mann. They will share their beautiful voices and other special messages with all of you amazing winners and warriors. So congratulations to all the churches. And with that, I will hand it back over to Francesca.
Wonderful. Thank you so much, Monica, and congratulations to Second Baptist Church of LA and Calvary Baptist of Hawthorne. The West Coast is strong, so really excited. But everyone did such an amazing job, especially since we pivoted, right? What we thought the program was going to be when we started at the beginning of the year is not what it ended up. But we hope that from AHA and from WW, we inspired change, we empowered you, and this is not the end. We are again a family within the Healthier Church Challenge, and so we want to continue to hear about what each one of the churches are doing to supercharge their health ministries, as well as continue the charge to be leaders in your communities. And so I know that we've run a little over time, but you know what? We had some great information to share today. So we see that some of you stayed on. So before we go, I want to give everyone one last moment with any parting words that you would like to share about how we can move forward from today. You know, we are going to be taking a short break for the Empowered and Well Healthier Church, Empowered and Well virtual faith community, but we will be back in the fall. So mark your calendars for that and be sure to check empoweredtoserve.org for that. So I'm going to actually ask Pastor Sonja, give us any last parting words for all of us on the call today as we venture into the summer and look forward to staying healthy. Oh, you're on mute.
There I am.
There you go.
As pastors, let's just make sure that we are very diligent in encouraging our members to adopt safe practices, and not just pastors, but all of us are ambassadors for safety. And now let us make sure that we address the residuals from everything that is happening. Specifically, there's great hunger in our community with people being out of work and so on. So we've got to still address those needs, but do it safely. And there's a way to do that. And it opens opportunity for us to tell even more people. I love the powerful W's that Dr. Sanchez talked about. So it is about disseminating information. And I think that all of you, thank you, AHA and WW, you've really helped us with a push to see how important it is to disseminate the information.
Awesome. Thank you so much, Pastor Sonja. Dr. Ellis, any last words you would like to leave us with?
Since this is a faith-based, I'm going to go there, that we have been given the gift from God to pause. And I hope, and we have to understand that we are not going back to the way it was. We're going to have 2 years of wearing a mask or whatever, and we're going to be in a different place in 2 years. It is going to be our decision if we're going to go back on that hamster wheel of life, or if we are going to be a better nation, a better person, a better brotherhood, a better sisterhood, a better planet afterward. And I hope that we take advantage of these difficult times to come out better.
Wonderful. Thank you so much, Dr. Ellis. Pamela, anything you would like to leave us with?
The only thing that I would like to say is just on behalf of the American Heart Association that we will continue to work alongside the faith community. We will continue to develop initiatives that allow for a better infrastructure for our communities in order for them to thrive. And so we need your voice, we need your leadership, we need your collaboration. And so there will be many more opportunities that will be presented to you. So please join in and listen, because there will be ways for you to secure dollars for your congregation, to look at housing, to look at bringing a healthy food market to your community. So please stay tuned because we really want to focus in on those systemic issues that are keeping us from being healthy. Thank you.
Wonderful. Thank you, Pamela. Monica, any last words from WW you'd like to leave us with?
Just, you know, I think to echo everything that was said by my partners in this initiative and this challenge, just to call out a couple of things that really stuck out in my mind, which was the Lift Every Voice for Action. I made a little bit of notes. Movement makers, leaders turn moments into movement. I think that's such a powerful thing. And as shared, we are all leaders. And so it's all our responsibilities to, whether it be big or small, to turn these moments into movements. So I just challenge us all to kind of drive forward with that in our minds. I dropped in the chat box if anyone is interested in kind of continued conversations or how we can support you as from WW perspective, reach out. The email is outreach@ww.com. My new role of the leader of inclusion and diversity, it's so important that we continue work like this and partnerships like this. So I hope to see you guys in the future.
Wonderful. Thank you so much, Monica, for joining us today and announcing our winning churches and the pastor of one of the winning churches, Pastor Collins. Any last words you would like to leave us with, as well as a congratulations to you and all of your health ministry?
Oh, most definitely. I'm so excited. Thank you so much. I just put in the chat box, wanted to thank American Heart Association along with Weight Watchers for leading this charge and making sure that our communities are getting healthier. Like right now, I'm really overwhelmed and even obligated of how can we as a church continue to partner with you to help this charge for other churches. How can we be a voice and how can we be advocates alongside with you as partners in helping spread this message and getting it out there. I'm grateful for everyone. I'm even especially grateful. I'm a native of Coshada, Louisiana. I grew up in the Deep South. I've only been in LA 13 years. So I'm from rebel flags and Jim Crow and things of this nature. And so I'm really also happy to hear all of the comments and the awareness that I've heard speaking on the issues that are plaguing our world today. I believe that change is coming now because everyone's attention is on board. I believe that we're not independent, we're interdependent. I need you as much as you need me. And that's how change comes, when we all pull together. And so I'm excited. I thank God. Life will never be the same. And I've learned when you can't change the situation you're looking at, you must alter the way you look at it. Because when you change the way you look at things, the things you look at change. So I'm grateful to everyone. Stay blessed. And you're stuck with me for life.
We are excited. We are excited that congratulations again to Calvary Baptist of Hawthorne as well as Second Baptist of LA. Dr. Sanchez, I'm going to leave you with any parting words from AHA that you would like to leave us with today.
So much to say, but I'm going to try to do it in about maybe 5 phrases. One, be aware of what's going on around you, both in terms of COVID, in terms of living healthy, and in terms of who you can vote for and what things are important to them. In this time of COVID, in this time of opportunity to change our world, please, 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 please exercise the right to vote and go vote for change. And I would just be remiss if I didn't say, wear your mask, watch your distance, and continue washing your hands. Because as Dr. Ellis says, for the moment, that's all we've got. And I would say reflect over the past few months and think about what would you wish effective government at the federal, state, and local level were doing to support you as you are trying to figure out how to navigate in this world of COVID, and vote for that change. I'll just leave it there.
Thank you, Dr. Sanchez, for those final words. And I want to thank each one of you for joining us. Thank you to all of our panelists for joining us on this Saturday morning. Let's give them a round of applause. And congratulations to the top 5 churches, as well as all the churches that participated in our Healthier Church Challenge, and those that were part of our virtual faith community. So again, thank you. These were all great calls to action, and I know we had some great notes. Thank you again, everyone, for joining us today. This was recorded, so check back on our website later this week, empoweredtoserve.org, to listen to it, to share it with others. And thank you for taking action, because I know that we gave you a lot of great opportunities and a lot of great tips to take action, because we can truly be the change together. So until next time, thank you again, everyone. Until next time, stay well, stay safe, and stay empowered. Bye.